Hello, good afternoon once again. Dr. Yakubu Ibrahim, Wildlife Hospital, Abuja. We're here again to talk about something related to our health in a series of our health talks. Today, we'll be talking about a topic related to use of antibiotics or antimicrobial agents. So we're going to be talking about what we call antimicrobial resistance. Now, what this simply means is how microbial organisms, bacteria, fungi or fungus, parasites, and viruses, in short, all the things that are known to cause infection in man, how these organisms develop resistance to treatment. And now, before I discuss it, I want to clarify something. Commonly, people come and tell us that they are resistant to certain medications. For instance, we hear people telling you or patients telling you that if you give me so anti-malaria drugs, I'm resistant to it. Or I've used these antibiotics before, my body is resistant to it. We want to talk about this and clarify it so that we understand that resistance is not developed by the person taking the medications. Rather, resistance is developed by the organisms you are trying to clear with the medications. So it is the organisms that develop resistance, not you that is taking the medications. So organisms develop resistance against medications so that the medications are poorly able to clear the organisms or they don't clear it at all. In other words, the infection for which you are taking the medications would not clear if and when the organisms in question develop resistance to the particular antimicrobial agent you are taking. So we have this commonly across board covering parasites. For instance, example of parasites in our environment that have developed drug resistance over time is malaria parasite. And we see the implication of that in treating malaria, whereby malaria seems not to clear easily with almost every existing anti-malaria medications we have. It's because over time, the malaria parasites has developed resistance to the medications we use. We also have examples of viruses that develop resistance to antiviral agents. Example is HIV virus. HIV virus is one of those very common viruses that develops resistance very commonly, Then we also have bacteria that develop resistance. Bacteria, things like bacteria that causes infections like pneumonia, gonorrhea, and the rest of them. So some of these bacteria develop resistance to some medications such that treatment with these medications don't seem to work. And that is where we need to talk about it. How do organisms develop resistance to this medication? There are two ways. One is because of the characteristics of the organisms themselves, and the other one is our behaviors related to drug intake and drug prescriptions. So as far as the organisms are concerned, how they develop resistance over time is by changing their nature. In other words, the microorganisms over time tend to change the nature which the antibacterial medications or antimicrobial medications were meant to attack. So, and this change sometimes is actually done by changing of the nature of genes of the organisms. We call it gene mutation. So once that happens, the organism becomes resistant to the particular agent you're trying to clear. So if you don't expose the organism to a new set of medications, as long as the genetic composition of the organism has changed, that medication will stop working. That is one way organisms develop resistance. The other way they develop resistance is by inappropriate use of medications, these antimicrobial agents. And there are two ways for that to come about. The first one is inappropriate use of drugs, in which case if you use drugs inappropriately, for instance, you have malaria or you have a viral infection or a pneumonia or any bacterial infection at all, You go to the hospital, they prescribe medication and tell you to take it for 5 days or 10 days or the number of days the doctors prescribe. And then you get back home and start taking the medications. A day or two later, start feeling better, and you feel that, oh, since I'm feeling better, you don't need to complete the dose that was prescribed. And then you stop. So halfway into treatment, you stop the medications because you felt better. So you may feel generally better, but sometimes the organism is not entirely cleared. Of course, the rest of the job may be done by your immune system, but the remaining organisms that you did not clear over time may become resistant to that particular medication that you didn't complete. So in other words, if you don't complete medications as prescribed by professionals, you are risking allowing the organism to develop resistance to that particular medication. And then the danger in this is that it's not only you that it may affect. If that particular organism escapes your own body and gets to another person, the same medications will not work. And therefore, sometimes you see that we have actually spread resistance of organisms across in communities. So that's one way drug use can cause resistance. The other way is where you use substandard dose of the drug. And this can happen in two forms. One is you are told to take a medication maybe 3 times a day or 4 or 5 times a day, and you choose to take it once or twice a day. Even if you complete the number of days, in this case, you are exposing the organism to suboptimal doses of the medication. And even if you get better eventually, sometimes you still have residual organisms that may develop resistance to that drug. And if you do that across different types of infections, then of course you are also spreading the risk of drug resistance by the organisms. Now, the other way drug resistance will come is where you have taken the appropriate prescription given to you by doctors, but you are unfortunate to have taken substandard medications, which is one of the problems we have in this part of the world. In other words, we may have fake drugs. And what we mean by fake drugs is where paracetamol, for instance, or ampicillin, for instance, is supposed to contain certain amount of ampicillin in a capsule, but because it's a substandard formulation, it contains less than what it's supposed to be. And when you are taking, though you are taking as often as you are advised to take, you are taking as for many days, as many days as you are advised to take, but you are still exposing the organism to substandard and suboptimal doses. So resistance to that particular medications may also develop. So why is this important? As I said, the reason why it is important is that at the end of the day, antimicrobial resistance to medications become a reason for treatment failure. Of course, it can affect an individual. It can also affect a community. One example of where a community, or in fact nations, not even communities, is the issue of malaria resistance to medication. And that usually almost always leads to frustration, treatment failure, and sometimes actually death can occur. Or where you're supposed to treat a simple infection, it becomes complicated, and sometimes even if death doesn't occur, you may end up with long-time disabilities or morbidities. So please, let's take note of this. On our part as individuals, make sure that whenever you're giving antimicrobial medications, ensure that you complete your dose, ensure that you take the number of days you are supposed to take. On the part of government and policymakers, it's important that we make sure that whatever drugs come into the country, they follow through and the appropriate regulatory bodies so that they certify and make sure that whatever it is claimed to be in those medications is what it is exactly, to avoid drug resistance. So hopefully this information will alert us and then make us more aware, and by acting appropriately, we should be able to prevent drug resistance, and it will be better for all of us. Thank you very much.